Hi everyone. Now today we will be taking up a new topic, that is redundant endometrium. It's a relatively new entity which has been described some few years ago only. And what is this redundant endometrium? Now we are all aware that the thickness of the endometrium varies with the menstrual cycle, and there is importance of the endometrial thickness. There is great importance of endometrial thickness in cases of infertility. So it becomes very important for us to know about the abnormalities of the endometrium. Now, a few things when we say that the endometrium is thick, what do we mean? We mean that the endometrium is thick relative to what we are expecting at that stage of menstrual cycle. But if I find endometrium to be thicker than what I expect at that day of the cycle, or I find that the endometrium looks very echogenic and thick in the proliferative phase, then I get a doubt that there could be something abnormal. Now, what can be that something abnormal? Now, for endometrial thickening, we are aware of two entities, that is endometrial hyperplasia. Right now, I'm talking about benign thing. Endometrial hyperplasia, which is diffuse thickening of the endometrium, and the other is endometrial polyp, which is focal thickening of the endometrium. We all know polyp looks like a discrete mass, and endometrial hyperplasia is a thickened endometrium which very often may have cystic spaces. So these two entities we are very well aware of. But what is this new entity, redundant endometrium? Now, sometimes what will happen when you are doing the scan, you will notice that in the proliferative phase, the endometrium looks very bright. Or you may find that this area looks like polyp, but it is not very clear. It is not looking very well defined, or I cannot see the boundaries properly. It just looks like an irregular thickening of the endometrium. That at a certain place, I find that endometrium is a little thicker, like a fold, or like a wave, no? So the endometrium is going like this, and then there is a raised area like this. So in polyp, what usually we see that there is this, and then it is a very clear cut separate area. Then another thing you will notice that this thickened portion will not give you flow like it gives in polyp. You see a stalk which has an artery and a vein. So there is a blood supplied to it with an artery, a single artery and a single vein going on into it, which you will not see here. Right, so this is also a focal thickening. But what is the difference between the redundant endometrium and the polyp is that the redundant endometrium is just like a little raised area or a wavy endometrium or a folded endometrium, while this would be a discrete, clear, well-defined mass-like area, the polyp. Then this will not show you a flow with an artery and a single artery and a vein flow. This will show you a single artery and a vein flow. And obviously the endometrial hyperplasia, it is complete thickening of the endometrium, and the edges of the endometrium are smooth, whether the inner edge or the outer edge, both are smooth in case of endometrial hyperplasia. Now, just like polyp, this is also not shed during menstruation, and it is more common in PCOS patients. And the histopathology also sometimes may show you hyperplastic changes like polyp or endometrial hyperplasia, and some cases it may be just a normal histopathological endometrium, while then it can be taken as a precursor to polyp, since it has features similar to polyp, because in some cases I've told you it may have hyperplastic changes. It can interfere with fertility. So these are the things. So actually, what is redundant endometrium? If I'm asked to define redundant endometrium, I would say it is a focal or diffuse thickening of the endometrium which has folds or waves. But the folds or waves, now when we are doing the routine transvaginal scan, we may not be able to appreciate these folds or waves. Why? Because we are not able to see the inner edge of the endometrium properly. So to be more confident about this entity, what we can do further, we can do sonohysterography or saline infusion sonohysterography, SIS, and then follow it up with hysteroscopy if needed. Right. So obviously I would not be covering the hysteroscopy part because that is not my field, but I'll tell you how it looks in sonohysterography. Now I have just put up all these pictures together so that you can get a comparison. The first one is a transvaginal scan showing you endometrial hyperplasia. You can see the smooth edges here on this side, and there are few cystic areas. So this is just the diffuse thickening, which is endometrial. The whole endometrium is thickened diffusely, mostly homogeneous with few cystic areas. To confirm that this is endometrial hyperplasia only and this is not a very big polyp, what we can do again sonohysterography. I don't have a picture of this patient with sonohysterography, but yes, if you will do sonohysterography in this patient, you will see that there is fluid in the endometrial cavity, and the edges of the endometrium, the inner edges, that is would be lining the fluid, like in this case, that would be lining the fluid, is straight and smooth. Fine. Then comes the polyp. Now, when we see polyp, it is usually seen as a focal, echogenic, well-defined, clear area. And when we put color, you can very clearly see the stalk of the polyp, the artery and the vein going into the polyp. When we do sonohysterography for the polyp, we can see a clear mass hanging into the cavity. We can see a clear-cut mass hanging into the cavity, and you can see its separation from the endometrial lining. No, there's a little edge. It has an edge. No, it is not like a smooth transition. See, compare this with this. No, there is an edge to it. It's a clear mass I can define, while this is just like a little thickening of the endometrium. The whole endometrium, if I look at comparing this area to this area, the endometrium here is slightly thickened compared to this endometrium. Now, this is the picture of redundant endometrium. Now, see, if you just look at the transvaginal picture, I am not seeing much here, except that, yes, I find that there is a little wavy endometrium and it is not looking homogeneous. Now, this area looks like there is something wrong here, and the area is heterogeneous. The cavity is also not very clearly seen here. But yes, I cannot be very sure that whether this is the endometrial polyp or this is redundant endometrium. So what I do, I put color. Now, when I put color, one thing I noticed that the color is, there is no stalk-like area seen going into this portion, and the color flow is just in the normal area of the myometrium, the arcuate and the spiral arteries and all we are seeing, but we are not seeing any color flow or a stalk going into this portion. Now, two things come to our mind, that this could be just normal endometrial hyperplasia, but then the endometrium here looks absolutely fine. So we are under confusion. What is this? So we do sonohysterography, and in sonohysterography, what do we notice? Some cases they will show you just a little thickening, just like I told you, like a wave or a raised area that you would see in the endometrium, and nothing else, right? And then this, if it was a polyp, we would have seen it like a mass protruding into the cavity. We just see this, there is a little diffuse thickening of the endometrium in this area compared to rest of the endometrium. If it was endometrial hyperplasia, then the whole endometrium would have been quite thick. This one makes it all the more clear. If you look at the thickened endometrium, it is not simple thickened, it does not have a smooth edge, it is having waves, it is having folds, it is irregular. So this again goes more in favor of redundant endometrium rather than polyp or endometrial hyperplasia. This one you can very clearly make out that this is a mass lesion, so obviously this is a polyp, and you have to be careful that you are not seeing this kind of a picture when the patient is in menstrual phase, because in menstrual phase that could be even a blood clot. So obviously you have to do most of the scanning. If you want to look for endometrial abnormalities, what is the best time to scan? The best time to scan would be in the proliferative phase or just at the end of the menstrual period. When the period has almost finished, the last day or the day after, you can do the scan and see. So what is the significance basically of redundant endometrium? The significance may be the same as polyp. Why I told you about this? Because sometimes when you are looking at such a picture where you find that this looks like a polyp but no color flow is not showing me a stalk or anything, then I can further go in for sonohysterography to confirm that this is whether this is redundant endometrium, and the treatment part I think would almost be similar to polyp. And you should be more careful about this in the infertility patients, because they say that biochemical receptors that you find in polyp are the same that you find in redundant endometrium, so they have a similarity, and this can be a problem in the infertility patients just like we have a problem with polyp. So I hope this was helpful, and you would be looking carefully for this entity. Thank you.